Hello and welcome to my macro presentation on vitamin K. I chose vitamin K because this vitamin is one that I deal with every day working in the anticoagulation clinic. So the roles of vitamin K, there's two main roles. The first role is it factors in bone metabolism, so it contains a protein that vitamin K is dependent on to decrease abnormal calcification in your bones. And it also plays a huge factor in your clotting in your blood. Prothrombin is the clotting factor in which our body uses vitamin K and is dependent on. It prevents bleeding in adults and infants with hemorrhagic disease. And it's also reversing the effects of people who are on warfarin because warfarin is a blood thinner and vitamin K works the opposite way. Benefits of vitamin K. So it supports your heart health, it improves your bone density, it improves your brain function, it helps with PMS, it helps maintain teeth and gums, it fights cancer, and it helps with blood clotting. There's two main forms of vitamin K. There's actually three, but vitamin K3 isn't very well studied or recognized as much as vitamin K1 or 2. So K1 is your green leafy vegetables and some fruits such as avocado. It's preferred vitamin K because it's definitely less toxic to your body. And vitamin K2 is the Staphylococcus aureus that's found mostly in eggs, fermented soybeans, chicken, meat, and cheese. So the RDA for children, adult, and pregnant women. So from birth to 6 months, it's usually the same for male and female. Again, 7 to 12 months is 2.5 micrograms for male and female. Ages 1 to 3 is 30 micrograms for both male and female. Ages 4 to 8 is 55 micrograms for both male and female. 9 to 13 is 60 micrograms for both male and female. 14 to 18 is 75 micrograms, even with pregnancy and lactation under the age of 18. And as adults, this is when our vitamin K recommendation changes. For males, it goes to 120 micrograms. Females is 90 micrograms, whether pregnant, lactating, or just regular. Vitamin K deficiency is not common in adults because most of the time we eat it in our foods, but unfortunately it is more common in childhood, usually infants, because they do not take in the vitamin K through formula or breast milk. It's usually just through the mother's placenta when in utero. People with gastrointestinal diseases such as celiac disease, ulcerative colitis, they're at higher risk for vitamin K deficiency because their body doesn't break down the nutrients it should from the foods that they eat. Major indications of vitamin K deficiency is bleeding and bruising, nosebleeds, and bloody gums. Prone adults to vitamin K deficiency are also people who are on anticoagulations, antibiotics, and one who are taking high doses of vitamin A and E. Nutrient toxicity levels are high doses of vitamin K. They can create definitely clotting problems, most dangerous in children, patients with diabetes or kidney and liver disease, people with reduced bile secretions. The signs and symptoms are it may cause low blood sugar in patients with diabetes. It can be harmful when receiving dialysis. It decreases your clotting factor when the liver disease is present, causing jaundice. And it has low bile salt levels because the vitamin K is increased. Because low bile salt levels are caused by an increase in vitamin K. It can be supplemented with nutrients that can lead to toxicity. Supplements are usually the only way for a toxicity event to occur. Usually people will not become toxic on just their nutritional intake without supplements. Here's a couple things that are rich in vitamin K. On the left, I have a bunch of different ones that people usually don't think, all which are green avocados, green apples, green grapes, asparagus, broccoli. So the most common ones that are high is your kale. That's usually 1062 of vitamin K. broccoli being your second, Brussels sprouts, cabbage, pickled cucumbers only because of the skin usually, asparagus, kiwi, okra, green snaps, and lettuce. They're the main things we try to tell people to eat if their vitamin K is low or their blood thinning aspect is too high due to their medications such as warfarin. A couple interesting facts that I found is in 2015 they did a review article that K2 activates the protein that prevents calcium deposits from forming in the walls of the blood vessels. In this article, the author cited finding suggestions that a diet high in the natural vitamin K2 may decrease the risk of coronary artery disease. Another one that I found was in 2016, a study investigated the effects of vitamin K2 in rats with metabolic syndrome, high blood pressure or high blood glucose levels, and symptoms of anxiety, depression, and memory deficits. After 10 weeks of treatment with vitamin K, the rats had normalized blood glucose, and they also had reduced symptoms of anxiety and depression. But it didn't improve any of the memory. That's kind of interesting to me because my family does have anxiety disorder and depression along with me and my son, so that's kind of neat knowing that, a natural vitamin can somewhat help that over due time. The last one in 2019, a study suggests that K2 significantly reduces activity of hypoxia-induced factor 1 alpha in hepatocellular carcinoma, which is the cancer cells. So it ends up being a good thing to target to enhance the use of targets for cancer drug therapy. So the more vitamin K we have, it creates us to have more HIF1A carcinoma cells, which then trigger the target cells for cancer therapy to target the cancer cells itself, getting rid of them or not allowing them to metabolize. This was a cute little picture that I found here up here in the top. That's the makeup of vitamin K. This is basically what, to the right, what our diet should entail, what percentage we should get from each of our vitamins for vitamin K. Again, it's a blood clotting factor, and here's your top 10 foods with vitamin K. Parsley is actually up there, but I don't know anyone who eats enough parsley to really suffice for an adequate amount of vitamin K. And also watercressants. I'm not a big fan of those. But spinach, basil, anything green leafy is usually what your vitamin K deals with. And maintaining the consistency of your vitamin K helps a lot when you're on anticoagulations, because then it's easier to make them more readily consistent. And here's your reference page, and thank you, and have a great day.